being a woman, a mother, somebody who has a professional dream, path that they want to be on, to then kind of heading into this phase of life of, perimenopause and menopause around the corner and the shifts that happen with that.
I'm familiar. Not until I met you did I realize how little I knew.
Oh, really?
Yeah.
Yeah. Well, I mean, I think I'm grateful for social media, because without it, we wouldn't have had the general awareness of these topics as we have today. So that's a great thing. And I'm big on education, and because I feel without the information, without the education, you as a patient, as a client, you're not able to make an informed decision on whatever it is that you need to decide on. And so if we can provide that level of education in a way that is simple to understand and that makes sense to you, and that's tailored to whatever you're going through, then it helps you make better decisions over time, right?
Yeah, and I do think that type of conversation is most impactful when it happens one-on-one with a patient in clinic or in a health coaching session, because the information is best when personalized, whatever the person is going through.
Yeah.
But maybe let's go into that a little bit. What are some general sort of things we should understand about perimenopause that are starting to come to light now that perhaps people don't realize how much might be impacting them?
Yeah.
I think as I'm trying to fumble my way through this, I'm trying to figure out what is the question I'm supposed to be asking, because I understand, everybody knows what menopause is. And my understanding of it is now there's a phase of about a decade before that happens where you can start to get signs and symptoms that maybe present as brain fog and energy issues, and perhaps you want to rip someone's head off, and not my words, your words. And it's really interesting to me, right? Because sometimes my wife wants to rip my head off. And what is it that we don't understand? Or that we're starting to understand that you wish more people understood?
I think the most important thing, firstly, is that we are moving and we're at a place now where we acknowledge that women, they don't need to suffer through this period and this transition that's happening. And it's a natural transition. It's going to happen to every woman, right? You're right. So let me ask you this question. What is your definition of menopause?
It is the transition where you go from being able to have kids to not being able to have kids anymore at the broadest level.
Okay.
I'm going to leave it at that, because if I say any more, maybe it looks stupid.
Okay, so think of it as a timeline, right? When girls are born, females are born, you are born, if you're born female, you are born with ovaries, and you are born with a set number of eggs. And those eggs are going to be released once a month. Once you hit puberty and you start your menstruation, you will ovulate as part of your cycle. That egg will be released once a month. That egg gives you the superpower of being able to conceive and carry a baby for 9 months if that egg is fertilized. You need sperm to be fertilized. So that happens, right? You get older, you have your menstrual period every month. We're talking average women now, right? You have your period every month, you ovulate, you release an egg, right? If in that particular month, there is no fertilization of the egg, what then happens is the lining inside the uterus then sheds, right? Because the egg is not fertilized, and so the egg and the lining of the uterus sheds, and that's your menstrual period. This happens every month. Again, we're talking average women with a normal cycle. Then you get to a point where, now let me just use a very arbitrary number just for the sake of explaining this in very simplistic terms. You have 100 eggs, and every month you're losing an egg. You're going to get to a point where the number of eggs are now down to double digits, low double digits. As you get older, your cells are also aging. Your body is aging. And just like the egg and the rest of the cells in your body, it's aging too. So the function of these eggs and its ability to do what it needs to do when you are in your 20s and your 30s is very different to the eggs that you now have in your 40s and early 50s. Menopause is a moment in time. And so we diagnose that, and it's a retroactive or retrospective diagnosis. We look back in time.
Okay.
So if a patient comes in and says to their doctor, they're usually it's around, 52, 55, you can oftentimes look to your mother. It gives you a good gauge of when you can expect to be going into menopause. But you have to have had the cessation, so no periods, for 12 consecutive months. And at that moment in time, that is when you are diagnosed as being menopausal.
Got it.
You haven't had your period, which means you're not ovulating. So the quality of the eggs are no longer there. The number of eggs are you don't have that 100 anymore. So the function of the ovaries has now kind of like the factory stopped working, simple terms, right? Yeah. When the factory stops working, that brings in a whole host of issues. Why? Because this factory actually plays a very important role in all cells in our body, right? From our head to our toes. The hormones that are part of this factory's processes, estrogen in particular, is on every cell in the female body. That's why the symptoms that women experience during the transition period, perimenopause, menopause, are so vast and can range from brain fog to itchy ears, to ringing of the ears, which we call tinnitus, to, they've noticed an increase in body fat, particularly around their abdomens, right? The central part of their body. It comes up as skin changes. They start to notice their hair doesn't have the same texture anymore. They have these mood changes, right? Where for no reason, they're responding in what would be described as a very overwhelming way for whatever's happening, right? It can't really be explained. Your sleep is shit. You're just off. You don't feel like yourself anymore. You don't have libido, maybe, right? And again, every woman is going to be different. Some may not have any of these. And it might not, or maybe they do, and it's not even noticeable that it's affecting their life. There are other women who can have multiple symptoms where it really affects their quality of life. But if you think about just human evolution, where we are today, if you, go back, let's say, 100 years, 50 years, no, let's say, 50 to 100 years ago, right? We weren't living 100 years ago. We weren't living to the ages of 85, late 70s, early 80s. We died. Women died, before the age, some of them before the age of 40. So, and now with healthcare becoming so advanced, our population advancing in every area of life, we're living longer. And so with that now comes another part of, we have this defining moment. So the 10 years, you have that cessation of periods for 12 consecutive months. And usually this is around the age 52, 55. That's menopause. The time before that is perimenopause. Peri meaning around this part of the timeline. And that can vary from up to 10 years. For some women, it could be only 6 months, 3 months, right? So it's a variable period. And then on this side of the timeline, you are now post-menopause. And so when the factory stops working, it means that your body is no longer producing these key sex hormones that you need to be able to function fully. Estrogen, progesterone, testosterone. And yes, women have testosterone too. We just don't have it in such a high concentration as men do. But it's a very important hormone in our body to allow us to function properly and optimally. So when your factory isn't working anymore, but you're expected to live for another 25, 30 years in this state with key hormones that are no longer there, it becomes a big problem. Now, historically, my grandmother, even my mother going through it initially, hormone therapy and treating this perimenopause, menopause, wasn't really a thing, right? And it wasn't a thing because, one, it was just for many years assumed that this was just part of the natural aging process. Like, this is just what you need to go through. It's life, right? We also then, the medical community, we were set back by a very large study that puts a big warning on hormone replacement therapy. And all of a sudden it went to, there's a risk of breast cancer. It's not safe to give hormone replacement therapy to women who are menopausal, postmenopausal. So obviously that created an environment where doctors were hesitant because that was the evidence, right?
And so what do we know now?
So now we know that the study that was relied upon, the data was not accurate. And there were, when you look at hormones in the human body, estrogen, progesterone, testosterone, that your body produces, it was very different to the hormone therapy, replacement therapy that was given to the study participants in this particular study, right? They weren't given bioidentical hormones, which is it's a key difference, right, in how you're managing it. So, the details and the nuances of that study compared to, the population that we were actually treating created fears that caused a pivot in how we managed women transitioning in this period of their life. So where we are today is, one, we are a lot more aware of these terms, perimenopause, menopause, postmenopause. With social media, that education level has risen, right? And we're now starting to see interest in the area because now it's like, okay, well, yeah, this is making sense to me now because this is exactly what I'm experiencing, right? Whether you're a perimenopausal female or postmenopausal, whatever your symptoms are, now it's like, okay, well, yeah, it's not just me. There's a reason why all these things are happening. There's a reason why I'm feeling this way. There's a reason why I feel like I want to just, kill my husband one day in one very specific moment. And then the next moment, I could be quite happy and elated.